Hello everybody, I'm Dr. Valeria Soltanik, and today I'm going to discuss the topic of the fear of the dentist. And we're going to start discussing a little bit about how to start losing this fear so you can seek treatment and take care of your oral health. So, why do you have fear? Why some people have fear of going to the dentist? Sometimes it is because of a previous dental experience, a bad experience, sometimes from a child bad experience, or a lot of people that I have encountered throughout my career come from other countries and they didn't use anesthesia back many years ago, or sometimes because they went to a dentist with a lot of pain and they still felt pain where they were working on them. So it's just generalized trauma. So today I tell my patients, the ones that present telling me the number one thing, oh, I'm afraid of you, I'm afraid of the dentist. That's why I haven't been to the dentist in years, or maybe never. So first of all, I tell them, why are you afraid of me? You just met me. Oh, and they start laughing. So they tell me, well, I had a very bad experience. Often it is from childhood. So I've heard many times that 30, 40, 50, 60 years ago, even more, they went as a child to the dentist and they worked on them without anesthesia. They took out a tooth or they did a filling and they didn't want it and they were crying, forcing them. So that automatically creates a bad experience from when you're a child, and you carry on this until your adult years forever if this experience doesn't change. So I tell my patients, well, times have changed. First of all, we use different materials, we use different techniques, and overall I think we're more gentle. So for example, anesthesia, you're afraid of the needle? Okay, so know that the dental needles, first of all, are very thin, and before we use a needle, at least in my clinic, so we use a topical anesthetic. So we put a little bit of a cream in the area that we will inject. We let that sit there for a little bit. So all that gum around that area that will be injected is numb already. So when we inject the anesthetic, you really don't feel the needle at all. And that is true, and that is how it is done. So don't be afraid of a needle, okay? I think it's very important to be relaxed, to be at ease when we will numb the area, because the muscles, believe it or not, if they're tense, then they reject the injection. They don't let the injection flow easily. So very important, you have to relax. Also, talking about the anesthesia, whenever we have to work on a tooth or on an area of the mouth, we have to do a filling, an extraction, an implant, anything that it's a little more invasive. So we have to numb the area or the tooth. Otherwise, we cannot work. And that's how I also try to relax my patient. You're not going to feel any pain, because in order for us to work in such a small area, precise area, and create everything that we need to do, the area has to be numb. So that means numb means you're not going to feel anything. The most thing that you could ever feel, it's maybe some vibration or pressure, if ever, but you're not supposed to feel any pain at all. That's, for example, one of the questions that I get asked when we're gonna do a root canal on a patient. Oh my God, I heard horror stories. They tell me, I've seen stuff on the internet, it's gonna hurt. No, we have to totally numb the tooth so you don't feel anything. nothing at all. So be assured that nowadays you have to use anesthesia. You're not going to feel anything, so you can relax. Another thing that the patients sometimes tell me, oh, I don't like to hear the sounds of the drill. I don't like to hear the sounds of your tools. Okay. Also, many years ago, the drills were much louder. Everything now is supposed to be more quiet. So you're not really going to feel a loud noise or anything. But I always say, if the sound is what makes you stressful, then I would recommend you to bring some headphones, so you bring your own music or a sound that suits you, or anything you want to listen to that will also help to distract you. But none of that is going to create any pain. Also, I have seen patients that because of fear, they have never been to the dentist. And it's not because they had a bad experience. It's just fear of the unknown, or just fear from things they heard from other people, or simply fear. Because we as humans, sometimes we're afraid of something that we haven't even experienced, because we create in our head an expectation of something bad that's going to happen. So, okay. So then I tell my patient, is it just that's causing you fear? Then those are the patients that I condition them the first visit. We'll go over the things that need to be done, and then we're going to proceed little by little so that the patient starts understanding that there's nothing to fear. Because it's very important for the dentist to know what's going on with the patient, to listen to the patient. I like to listen to why my patient is afraid. What happened before? I consider that part of the medical history. It's part of the whole complex of things that I am finding out to know what to do. Because if you're afraid, I want you to lose that fear, because it's very important for you to take care of your oral health. Those patients, some, not all, that have never been to the dentist and they present to my clinic as an adult. So it's many years of neglect. It's many years of not checking what's going on in their mouth. It's many years of not educating that patient to what needs to be done. So it's very important. Take the first step of schedule the appointment to go see the dentist. Schedule the appointment to start taking care of your oral health. Try to find a dentist that will listen to you, that is going to help you lose that fear, because it's very important. I listen to the patient. I want to know why. Why? So that we can correct it. These patients that lose the fear, that they become my patients, I see that they always tell me the same. Oh, when can we continue? When can we do the other side? Like, they're even more eager to work on, what needs to be done, because they see that there's nothing to fear. So remember, we cannot work on something that is hurting you. We cannot work if you're in pain and if we don't give anesthesia. Can you imagine if I worked on a tooth that I'm doing a filling or something and you're jumping around? No, that cannot be done. So lose that fear. You have to relax. You're getting health. You're getting your smile repaired. You're getting everything checked. Because sometimes it might be too late. Also, if you find something in your mouth, I always keep saying this, something out of the ordinary on your tongue, lips, cheek, under the tongue, something weird, something that you haven't seen before, something that looks funny, you have to go see a dentist, because sometimes neglect of these things can lead to more difficult things to treat. It can lead to problems. So it's very important. Lose the fear, lose everything that scares you, or talk to your dentist, talk to a professional that will help you lose this fear. So I'm gonna continue doing some videos to condition people so that they can start scheduling the appointment, losing the fear, exercises to relax before going to an appointment. It's very important. So if you have any questions or you have any trauma that you want to discuss, I would please ask you to put it in the comments in the video so I can do other videos to help you, because I really want to help you to lose the fear so that you can have the road to a perfect and healthy smile. Thank you very much for watching the videos. I'm Dr. Valeria Soltanik.